Hello, everybody. I'm Bob Dempsey, and on behalf of the Department of Neurological Surgery at the University of Wisconsin, I'd like to welcome you to a short update on where we are with COVID-19 at this time. It's important, as you may notice, that these updates are becoming uh, intervals that are based on when there's news to report. And I think there is new news on the vaccination front, which needs to be explained and put in perspective. The first thing to know about COVID is that we've been at this a long time. We're literally going to be talking in the future about before COVID, after COVID, during COVID times. And we're for the first time beginning to think about after COVID, which is great because it's been a long time. This disease was named in 2019, discovered very late in the year there in Wuhan, and became really every part of our life in 2020. At that time, it was an extremely virulent and extremely contagious disease that was killing young people, old people, doctors, nurses, medical staff, etc. It had some particularly virulent characteristics in the elderly, and it was devastating for people at high risk. But these major infections or endemics or pandemics, meaning infectious disease that goes worldwide, have been going on forever throughout time. And if we understand those, we understand a little bit about what happens. Many of these are 4-year events. But really in the past, before all the measuring and imaging and testing that can be done nowadays, we didn't know that they were even present the last 2 years. In other words, there were 2 really rough years and then people kind of thought they were beyond it. There were people getting sick, but they weren't sure which disease it was. It was a milder form. And then generally that disease, rarely would it disappear, but rather it would sort of drift back into the background of other lesser infections you might have seasonally. This is particularly important for COVID because it is a respiratory virus, and respiratory viruses tend to be seasonal, meaning in the wet, cold season of winter that's coming up. So if we can get through this winter without a major spike in COVID, we may well be on that course of getting past this, where it drifts back into endemic, meaning it's in the environment. We get sick, we don't differentiate that from a cold or other infections, and we go on with our life with minimal effect on morbidity, mortality. It's important to understand why this wasn't just a cold 2 years ago. Indeed, the effects on populations have been devastating. Nursing homes, elders, families, all affected, and entire classes of people. In the United States, the Native Americans, always been at higher risk of illness, found in the last 2 years their life expectancy as a people dropped 6 years. That's unheard of. To think that your life expectancy as a people would be dropped 6 years in the space of two means this was devastating. And so that gives us some idea. Why are we in a better place now than we were 2 years ago? Well, three things. One, we were very careful and limited spread. Some of us who have been wearing masks and washing our hands and being careful haven't even had a cold for 2.5 years. Never in my life have I had that happen before. So just being cautious is important, and it teaches us a lesson for the future. Second is the virus changed, and that is the nature of a very rapidly dividing virus that mutates. It changes, and most of the really, really serious mutations wipe out the virus. So what mutations that allow it to survive tend to also make it less virulent. And we, along the lines, really mostly last year, saw a major change with Omicron to something that is very contagious, but not very virulent. So the death rates have plummeted, but the amount of actual clinical infections is quite high. It's hard to be exact about that because we aren't testing at only isolated places now. People are testing with drugstore tests and often are not reporting their positive results. So we know how common it is by looking at people who miss work, people or people who come in for elective surgery and are tested and then are turned away. They have to come back after they have cleared the illness they may not have even known that they had. In this way, we know where we are is a much better place. We still have people dying of COVID, but we're talking single digits in the state, which is tenfold better than it was at the height. We still have a lot of people getting sick, but not very sick, because we don't have as many people being hospitalized and don't have as many people dying. And remember, I told you 2 years ago, watch the hospitalization rates, because that'll tell you who's really sick and whether the virus is changing to a lighter form. It still can cause lasting effects in some people, but as we have gone to 2022, more people getting sick, even though they took precautions, even though they were vaccinated, even though they may have had the illness before. Okay. Now, we know that the rates are such that we still have maybe 24 people in the hospital at any time with COVID. But unlike previously, when they were here dying of COVID, 2/3 of those people are here because they need something urgent, appendectomy, cardiac cath, etc., but also have COVID. And we take care of them very cautiously. Only about 8 are in the hospital because they're sick with COVID. That's much better than the 80 and 90 we saw before. Now, the other important reason is we discovered new types of vaccinations. The initial vaccination targeted at the initial mutation was extremely effective. And it worked, and we thought that would wipe it out, but not everybody got vaccinated, and certainly worldwide, because we are brothers and sisters to people worldwide. Unless we eliminate the illness there, it'll come back to us. And so what we found is that those people were very protected, but two things happened. The protection waned, mainly because the antibodies did not last as long as they do for, say, polio or smallpox, but also because the mutations began to defeat the vaccines, not in virulence, but at least in infection. People were getting infected. Now a new thing has happened, and that's why we're holding this, is that they have a new booster shot this fall. And it is the booster we talked about we were waiting for. Because the previous boosters were just another dose of the original vaccine. Maybe a little different dose, but the same vaccine. Which meant that as the virus changed and the vaccine didn't, it had become less effective. This particular vaccine, which is being released like this week by the two major companies, Moderna and Pfizer, is targeted at the present mutant. Therefore, we can predict it should be much more effective. And going into the fall and winter respiratory virus season, this makes a lot of sense. So even if you've had other shots more than 2 months ago, I do recommend the new booster, unless you have counterindications to it. I do recommend it because it makes sense. Now, having said that, this particular vaccine is much like the flu vaccine. They take something that's been established, the original two vaccines, they modify the antigen to the target, the new Omicron target, and they put it out. It hasn't been tested for efficacy the way the other ones were, but because it's so similar to the others, it's considered to be safe. We are only implying that it'll be more efficacious. I certainly hope it will be, because if it is, and we keep from having a spike of COVID in this fall respiratory season, it'll be to me a signal that we really have made this an endemic disease, a background disease. It's going to be here. We'll live with it. It's a nuisance. We changed the way we monitor things. We are more cautious and hopefully more considerate of each other. I think that's probably the most important thing to say. So this is a time to be equally careful, as we always have been, equally useful about masks and hand washing when you feel appropriate, especially in indoor settings, and equally considerate of each other. Because I think this is getting better. We are opening up. I'm still a little slow, a little cautious, maybe overly cautious about masking, etc. But I think that there have been good health benefits from that. That's one thing we learned. And we can modify our lives in that way. So this is the next step. I think it's a very good one, but I think one of the ways to assure that we will get past this disease is to strongly consider this newest booster, which is formulated against the present variant. Now, what's the future? Well, I suspect this will be, I thought it would be this fall, but it hasn't yet, combined into a vaccination with flu. And I guess that's going to be next year. But I think that's what will happen. We've had 4 vaccinations. This is the 5th. I hope it'll get down to just 1 per year in the future, just as the flu shots do. But I think you can see that this combined approach of caution, protection, consideration, and vaccination is probably the way we're going to handle this long into the future. I will spend just a second to mention monkeypox. Very different condition, not likely to be so very easy to spread. Takes direct contact with infected people. It sounds like chickenpox, but it isn't at all. It actually it acts more like smallpox, but in a milder variant. It still is a disease nobody wants to get because the involvement of the skin can be quite painful. And you don't want any part of that. Other complications as well. High risk people would be wise to consider vaccinations. They appear to be effective, but it is not commonly spread throughout society. And therefore, it's something that you keep an eye on. And if you're in a healthcare setting, you be very careful about. But we are already hand washing, gloves, etc. are essential when we deal with rashes, exposed skin, skin lesions. In your everyday life, you're unlikely to see this. At least that's the way it stands now. So I hope this is very hopeful because, in my opinion, it is a hopeful time. And if we can get through the winter respiratory virus season without an uptick in COVID, we will have succeeded. And I think the best way to assure that is to participate in the newest vaccine. That's the news right now with COVID. And it's kind of good not to be talking about death and destruction because we're beginning to travel more, but carefully. And we're beginning to realize that we've learned something from this. And that's always should be our attitude. Thank you all very much. Take care now.